Hi guys, Dr. Hirsch here. Welcome to my YouTube channel. Today we're gonna do something fun. We're gonna use a whiteboard because I wanna walk through the stages of menopause and the different definitions. This is actually really important, something that I teach all the students who come through my courses who are clinicians, because sometimes it's not that easy to know what stage a woman is along the perimenopause to menopause journey. And it's also really important because certain things can have different meanings. For example, bleeding can have a different meaning if you're perimenopause versus menopause. So if you want to learn all about the different stages of the transition, stick around. This is going to be a great video. If you don't know me, I'm Dr. Hirsch. I'm the CEO and founder of the Hirsch MD Collaborative. It's a private telemedicine practice. If you want to become a patient, check the links in the description below. I also teach clinicians and had worked at academics for many years before starting my own practice. All right, let's get into what we're here for today. For this video, I wanted to use my brand new whiteboard because I do think if I can actually draw this out, this visual is going to make these definitions so much clearer. Now, there is actually something called the straw stages of menopause. We're going to use that loosely, but we're also just going to say this really in plain English so that it makes sense for you when you're either trying to talk to your clinician or you're thinking about, what stage you're in to help you make treatment decisions. Let's start with the biggest one, which is estrogen. Now, you might find this interesting. This is what estrogen does every single month. Estrogen goes up and down every single month. At the top here, this is ovulation. And then down at the bottom is when women usually have their menses, or we usually call it their period. What's really interesting is that during ovulation, studies actually show that women are actually their smartest, and if they're ovulating while taking SATs, they tend to score a few more points higher. And estrogen also really impacts the mood. So estrogen is a natural SSRI, which means that it keeps serotonin in the brain and it blocks the destruction of serotonin. So at ovulation is when most women feel their smartest and happiest. And estrogen drops right before a woman is going to get her period and bleed. Now, this is premenopause. What happens as women go into perimenopause is estrogen does two things. Estrogen lowers and becomes more volatile in perimenopause. So it can look like this. Instead of these nice ups and downs, it's more like this. And then maybe a big spike, and then a big spike. Okay? This is perimenopause. This is really what happens again in perimenopause as your estrogen starts to both decline and then become more volatile. This is why in perimenopause, as women, we can have breast tenderness. It kind of feels like it's puberty in reverse. You're thinking, I haven't had this type of soreness, my breast tissue, for a really long time. And that's because it can have these really big peaks. Now, menopause is when we really don't make any estrogen anymore. So really what happens at this point is that the estrogen just kind of peters off. And estrogen levels post-menopausally for women not on hormone therapy, estrogen is usually between 0 and 20. Let's call this menopause. All right, so you've got pre-menopause, perimenopause, and menopause. Let's talk about what happens to the progesterone. Let's do the progesterone in black. Now, progesterone actually does the opposite of what estrogen normally does. So when estrogen's high, progesterone's low, and vice versa. So if you're looking at someone who is still having regular periods, progesterone's going to do the opposite. It's going to go like this. So what does that mean? Well, if this is right before your period, well, there's no red, so we'll use pink. If this is right at your period, progesterone is the highest, and progesterone is increasing the week before your period. This is actually the PMS week, right here. So during PMS, physiologically, the estrogen is declining and the progesterone is increasing. And so progesterone can cause water retention. So if you ever feel like you've gained a little bit of weight, it's usually water retention as the progesterone is rising. And if you feel like your mood is dipping, that could be the estrogen lowering. If you're prone to migraines or menstrual headaches, that could be the estrogen lowering. So PMS is physiologic. It's not something that was socially constructed that was made funny for movies or TV. Why this is so important is that this process of PMS is basically what happens most of perimenopause. So let's go over here. As women get into perimenopause, the progesterone just starts to decline even earlier than estrogen does. So it might look like this, where the progesterone's kind of going like this and then just kind of beats it early. In perimenopause, with the low progesterone, this in some women can cause anxiety and insomnia. Progesterone works to increase GABA. It's a calming neurotransmitter. And so if GABA is declining as that progesterone is also disappearing, this can increase anxiety and insomnia in perimenopause. So this is a really important definition. Perimenopause. Perimenopause can last 1 to 10 years before a woman's final menstrual period, which is menopause. And perimenopause is really defined as a time where women are experiencing symptoms of low estrogen and low progesterone, but they're still having some bleeding or periods. So this is definition number 1, perimenopause. Definition number 2 is menopause, which is defined as 1 year of no periods. And this is actually very, very interesting. Menopause is actually this day. It's when it's been 12 months of no bleeding. You can say, this day I am in menopause. And every day after that, you're actually post-menopausal. Yeah, this is post-menopause. So that's post-menopausal. Once you're postmenopausal, you're always postmenopausal. Just like if you were ever had a baby, once you're postpartum, you're never the same. You're always a postpartum woman. Once you've had that 1 year of no period, that day is menopause. And then every day after that, you are postmenopausal. So far, the definitions that we've covered is premenopause, perimenopause, the 1 year no period, which is menopause, and then postmenopause. All right, there is a few more important definitions of menopause that we need to discuss. The first being surgical menopause. Surgical menopause is when both ovaries are removed, not just one, because actually one ovary can work really, really well. So reasons for surgical menopause include, having severe endometriosis where the surgeon decides that the endometrial tissue has engulfed both of the ovaries. So to decrease that chronic pain, he or she takes out both ovaries. Another really common reason for surgical menopause is having a high risk for genetic breast and ovarian cancers, for example, BRCA1 and BRCA2. For this reason, a lot of women will have risk-reducing oophorectomies bilaterally, which is a fancy way of saying have both of their ovaries removed. Or you could have both ovaries removed because of ovarian cysts or torsions or other reasons. Remember, it's only surgical menopause when both ovaries are removed, or some of my patients have had one ovary removed and then a year or two later the other one, and it's when the other one gets removed that you're really in surgical menopause. But that terminology wasn't sufficient because sometimes women can have a good month and still ovulate afterwards. So premature ovarian insufficiency is likely to be an autoimmune condition, although we don't have all the reasoning or etiology behind why menopause can happen before age 40. Now, importantly, if you're diagnosed with premature menopause, the gold standard of care is hormone replacement therapy. This is because without it, a woman is at increased risk for bone loss, cardiovascular disease, a brain health dysfunction or dysregulation or cognitive changes, and worsening quality of life. I actually have a really good video here all about premature menopause because if this is you, you're definitely going to want to check that out. And the next definition to know is early menopause. Early menopause is defined as menopause between 40 and 45. This is also where we would recommend as the gold standard of treatment hormone replacement therapy. But again, if you're under age 40, this is of particular importance because you are 1 or sometimes nearly 2 decades early into this transition, and this could really, really impact not just your quality of life, but your longevity. So surgical menopause, removal of both ovaries, premature menopause, menopause before age 40, and early menopause is menopause between ages 40 and 45. Now, if you're a woman watching this and you don't get periods, so you don't know if you're in the perimenopause or, menopause, post-menopause category, what do you do? Well, this next part applies to women who've either had a hysterectomy, but you have your ovaries in place, you have a progesterone-releasing IUD, in which case you don't have periods, or you've had an ablation, which means you also don't get periods. You'll never really know when it's been 1 year of no periods because you haven't been getting them. And great, that's convenient for you. You are going to now want to look at 2 lab tests, a follicle stimulating hormone and an estrogen level. If this applies to you, you're going to want to look at these 2 hormone levels. FSH stands for follicle stimulating hormone level, and estrogen is your estrogen level. If this is over 35 and your estrogen is less than 20, it is likely but not definite, that you are post-menopausal. And again, the reason is that period history will always trump lab work. It's a reason we don't necessarily recommend lab work for women in perimenopause because really it's a clinical diagnosis. Perimenopause is a clinical diagnosis. I'm the clinician, I decide. But if you don't have periods, you'll never really know. So the best that you can do is actually check your lab work. Now, the last definition is really women who are on continuous oral contraceptives, so your traditional birth control. With birth control, it's going to bring your FSH level down. Even if you are a 90-year-old lady on birth control pills, your FSH is going to be really, really low. So you'll never really truly be able to tell your stage if you are on birth control pills. If you want to know your stage, the best thing to do is to stop the birth control pills and wait at least 8 to 12 weeks to get those labs drawn, FSH and estrogen, so that you can get some idea of where you are in the transition. All right, guys, I hope that was really, really helpful. I think really knowing these definitions is crucial. Again, it's something that I teach my clinicians and all the allied healthcare professionals in my courses. And this is because we did not get adequate information about the female reproductive cycle in our later and midlife years in our training. And it is unfortunate because generations of women have now suffered. But now you know the difference between premenopause and perimenopause and menopause and what those hormones are doing. We covered the definition of being postmenopausal as well as surgical menopause, premature menopause, and early menopause. We also discussed how can you decide where you are if you're a woman who doesn't get periods. If this was helpful, tell me in the comments below. If you would like more videos on this topic, let me know. Just tell me what you're interested in learning and I am happy to make these educational videos for you. If you would like to work with me or my team, definitely consider the Heather Hirsch MD Collaborative. Is one of the premier places to get menopause and perimenopause support. We know everything there is to know, not just about HRT, but about women's health in general, because we want to age beautifully. We want to build generational health. If you'd like to be in any of my courses, if you're a provider, a clinician, if you work with women in the 45 to 55 age range, definitely check out the Heather Hirsch Academy down in the links below. Hope you guys love this video and I'll be back for another one next week. Bye everyone.